Stop. If you are a woman under 50, what I'm about to tell you could save your life. Lung cancer rates in women under 50 have now matched or even surpassed those of men in many countries, including the UK and the US. And here is what's shocking. 20% of these women never smoked a cigarette in their life. The number one cause isn't what you think. It's invisible, odorless, and could be in your home right now, slowly damaging your lungs. In this video, I am revealing 7 hidden reasons young women are getting lung cancer at alarming rates in the UK. Reason number 1 is in 1 in 15 homes, and most people have no idea. Hello, I'm Dr. Suman, a respiratory consultant in the UK. I have been treating lung cancer patients for over last 10 years, and there is an alarming trend that I'm noticing right now. For generations, lung cancer meant older, male, heavy smokers. Sometimes we even see patients who work with asbestos developing lung cancer in the future. But that picture is now changing. For women under 50, diagnosis rates are now significantly higher than men. Let me tell you about Sarah, an imaginary patient. She is 35 years of age, non-smoker, and quite physically fit. For 6 months, she had a dry cough. Her doctor said it could be asthma, could be allergies, and then possibly post-nasal drip and possibly reflux. She was diagnosed to have lung cancer, quite advanced stage. Now let's count down the possible 7 reasons that could have caused her lung cancer. Let's start with number 7. Something your doctor probably never asked you about. The 7th reason is where you live can be killing you. Who lives in older housing with poor ventilation? Who lives near motorways, industrial plants, breathing polluted air daily? Sarah lived in an affordable apartment next to a busy motorway for years. This constant exposure to toxic emissions was silently damaging her lungs. And getting a doctor to take a young woman's cough seriously is already hard. Add limited healthcare access, that delay can be fatal. But reason 6 is crueler. It comes from something that saved your life. Number 6 is radiation from previous cancer treatments. Radiation therapy or radiotherapy saves lives for Hodgkin's lymphoma or breast cancer. But the lungs receive exposure to this damages the DNA in the lung cells and decades later can cause cancer. Imagine surviving cancer only to face another battle years later. For survivors, any respiratory symptom cannot be dismissed. Reason 5 affects millions, and it's not what you think. Number 5 is outdated lung cancer screening guidelines. 20% of lung cancer diagnoses are in never smokers, and most of them are women. Sarah smoked maybe 5 cigarettes in college. Lung cancer seemed impossible. Here is the problem. Screening guidelines target older, heavy smokers. A 35-year-old non-smoker doesn't qualify for early detection CT scans. This leaves young women unprotected, diagnosed late when treatment is the hardest. But even if you never smoked, reason 4 exposed you anyway. Number 4 is second-hand smoke, which causes thousands of lung cancer deaths each year in non-smokers, around 1 in 12 cases in the UK. For many young women, exposure happened even as a child. Sarah's dad smoked indoors all winter. Windows shut, air thick with toxins during critical lung development. That childhood exposure doesn't vanish. It damages cells for decades before showing up as a cancer. But reason 3 affects everyone every single day. Number 3 is air pollution. Tiny particles from car exhaust and industrial emissions directly cause adenocarcinoma, the most common type of cancer in non-smokers. PM 2.5 particles triggers cancerous changes in the airway cells. People in polluted areas have DNA mutations similar to smokers. Sarah lived in a city, commuted, jogged in the city parks, breathing these particles daily. For every small rise in fine particulate pollution, lung cancer risk increases by around 10 to 15%. The threat is invisible everywhere and changing everything we knew. Now the top 2 reasons, and number 2 answers Why me? Number 2 reason is your DNA. For young non-smoking women, the driver is often an EGFR gene mutation. When mutated, it gets stuck on telling cancer cells to grow uncontrollably. EGFR mutations are significantly more common in women, non-smokers, and Asians. These aren't inherited, they are acquired randomly, possibly triggered by pollution or unknown factors. But one cause tops them all. Number 1 is responsible for 21,000 deaths yearly. The number 1 reason is radon gas exposure. Radon is invisible, odorless, radioactive, released from uranium decay in soil, seeping through foundation cracks. It's the leading cause of lung cancer in non-smokers. Women face higher risk because they spend more time indoors. Living with high radon is like having a low-dose radiation daily. Never smoking women with radon exposure have 3 times higher lung cancer risk. For Sarah, this was it. Her basement apartment for 5 years was in a high radon area. Nobody told her to test. It's actually a simple test to get done, but awareness is dangerously low. So what happened to Sarah? After months of dismissal, Sarah demanded and finally had a chest x-ray. Her doctor called her back with results. His voice was different. They had seen something. A week later, stage 4 lung cancer. It's spread. It wasn't allergies or asthma. It was real lung cancer. But her cancer had that EGFR mutation. That wasn't a death sentence, it was a target. She qualified for targeted immunotherapies, far more effective than traditional chemotherapy. Her fight began, but with knowledge, not in darkness. Sarah's story is your wake-up call. These 7 reasons are alarming, but knowledge is power. A persistent cough, breathlessness, or chest pain in young women cannot be ignored. Advocate for yourself and the women you love. If you are experiencing symptoms or anything here concerns you, expert evaluation doesn't mean months of wait. Through my private respiratory practice, I offer comprehensive lung assessment for people who don't fit traditional high-risk profiles. This includes advanced diagnostics, personalized risk assessment, and direct specialist access without NHS waiting times. Early detection changes everything. You will find the booking link in the description box below. Please share this video. Send it to your sister, your daughter, your friends. The outdated stigma is costing young women their lives. You could save a life. Lung cancer's face is changing, but understanding this risk changes outcomes. Test your home for radon. Push for cleaner air. Know your risk. Most importantly, listen to your body and demand to be heard. If this opened your eyes, subscribe to this channel and share this video. Check my other respiratory health videos on this channel. Your health is worth fighting for. This is Dr. Suman, helping you protect your health one step at a time. See you in the next video.